Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. So this is the magic pill session, and today the important topic what we are going to discuss is ECT, electroconvulsive therapy, and the vital points is related to ECT. So ECT previous year questions, whatever they are asked previously, those questions we are going to discuss, and related vital points also we are going to cover here. So watch the video till the end. Definitely it will be so much useful for you, especially for upcoming exams like mains, NORCET as well as for RRB. Okay, so let's begin the session. And if you like the video, please like it, share it, and please subscribe the channel so that it will motivate us to post more and more videos. So let's begin the session. So the topic already I explained, it is ECT in psychiatry nursing. So let's start with the definition of ECT. Okay, so ECT, electroconvulsive therapy, actually it is an artificial induction of grand mal seizure. As you all know, what is seizure, right? So seizure is an abnormal electrical impulse transmission which is originated from the brain. There are two types of seizure, that is partial seizure and general seizure. So here, by giving ECT, electroconvulsive therapy, we are going to generate the general seizure, that is grand mal seizure. Okay, we are going to start or initiate what? Grand mal seizure for the patient. So in this definition, they have given very clearly artificial induction of grand mal seizure. As you all know that grand mal seizure, in the sense, one of the type of grand mal seizure is tonic-clonic seizure. So this type of tonic-clonic characteristics will be there if you are giving what? ECT. Okay, so this is the definition of what? Electroconvulsive therapy. So artificial induction of grand mal seizure. Okay, by giving the low volt electricity for the patient. Okay, so here tonic-clonic, this kind of characteristics will be there. Okay, fine. So the first question what we are going to discuss is the first therapeutic use of electricity induced seizure in the treatment of mental disorder is related to. So as usual, every time you have to check for the key points. So here the key point is the first therapeutic use of electricity in seizure. Okay, so here they have given four options. So Binney and Serletti, D. Goldman, Harlot A. Sakim, and Sigmund Freud. So here the right answer, as you all know, the person who used the electroconvulsive therapy for inducing the seizure in medical disorder is option A, that is Binney and Serletti. Okay, so additional important points are the first ECT was performed in 1938 by Italian psychiatrist known as Binney and Serletti. So his native is Rome. Okay, so at what time he has performed the first ECT? It is performed in 1938 by the Italian psychiatrist. Okay, so the name of the Italian psychiatrist is Binney and Serletti, and where this first ECT procedure was conducted, it is conducted in Rome. Okay, fine. And the next important point is the major indication for ECT is major severe depression with suicidal attack. This is the first priority indication for ECT, electroconvulsive therapy. Even though it is a simple questions, so simple to complex, always we used to go with what? Simple to complex, right? These questions already asked so many times in the exams. That's why I scrutinized some questions and I'm giving to you. Okay, so let's see the golden points also related to each and every question. So for this question, the right answer is what? Option A, that is Binney and Serletti. Okay, and the next one, what is the absolute contraindication for ECT? They are asking the contraindication. Underline the key point, absolute contraindication. So there are two types of contraindication. You can see very clearly in this slide, absolute and relative contraindication. So in this question, they are asking the absolute contraindication, and four options they have given here, and hope everyone knows the answer also because it is already displayed here. So the right answer is option A, that is increased intracranial pressure is the absolute contraindication for what? ECT, electroconvulsive therapy. Okay, so if there is an absolute, definitely there should be a relative contraindications also. You can see the relative contraindications very clearly here. So relative contraindications are aneurysm, that is cerebral aneurysm, cerebral hemorrhage, brain tumor. So all these things are related to the brain. Apart from that, heart failure, retinal detachment, and acute myocardial infarction, these are all also coming under what? Relative contraindication. So two types of contraindication, absolute and relative, and very important here is absolute contraindication, that is increased ICP. In this situation, we should not give what? Electroconvulsive therapy. Okay, so the next one is the voltage needed to produce seizure while giving ECT. So what is the recommended voltage for ECT? Okay, so the voltage which is used to produce the seizure in the ECT. So this is the direct question. And you can see the options here: 180 to 220 volt, 40 to 70, 150 to 180, 70 to 150. 4 options are given here. Among this, the right one, as you all know, very simple, direct question. So 70 to 120 is the right answer, but in the option 120 is not there, 150 is there. So we have to go to the nearby option. So here the nearby option is option D, that is 70 to 150 volt is the right answer for these questions. Okay. So other vital points we can see here. According to American Psychiatric Association 1978, they have given these 3 important golden points. The first one is the recommended voltage, that is 70 to 120 volt. We have to use for the ECT. Okay, for generating the seizure, we have to use 70 to 120 volt only, not more than that. Okay, so up to 150, okay, it is all right because it is given in the options. And the next important one is, so how much amount of current is passed in the patient? So the usual amount of current passed in ECT is 200 to 1600 milliamperes. Okay, so 200 to 1600 MA. So the first golden point is volt, that is 70 to 120 volt. And in other words, if they are asking in MA, means 200 to 1600. And the next one is duration, how long we have to give the ECT. So 0.7 to 1.5 seconds. 0.7 to 1.5 seconds only we have to give the electroconvulsive therapy, so that if you are giving this electroconvulsive therapy for 0.7 to 1.5 seconds, this 70 to 120 volt, if you are giving for the patient, means it will stimulate the grand mal seizure. Okay, fine. So usually we have to go to the nearby options, even in case of duration, if they are giving 0.1 to 1 seconds. Okay, so it is nearby, means we can go for the nearby answers. Okay, but the exact duration for giving the ECT is 0.7 to 1.5 seconds. Okay, so the next one, type of seizure produced. So as I mentioned already, see, 2 types of seizure is going to be there. Actually, a grand mal seizure will be there for the patient. If you are giving the ECT, a grand mal seizure will be originated. Okay, so it is a generalized seizure. So in the grand mal seizure, one of the type is tonic and clonic. Okay, so tonic means that stiffness will be there, and clonic means jerky movement, that is convulsions will be there. Okay, these 2 phases will be there for the patient while you are giving the ECT. So mainly we are giving the ECT for generating the seizure only. Okay, so in this 2 types of phase or seizure you can expect. The first one is tonic phase and second one is clonic phase. Tonic means stiffness will be there, and clonic means convulsion or jerky movements will be there. So the tonic phase will last for 10 to 15 seconds and clonic phase it will last for 30 to 60 seconds. Okay guys, the next one is indication of ECT. What are all the indication of ECT? Already we know that major depression with or without psychotic features, that is suicidal tendency. Okay, so this is the first and foremost indication for giving the ECT. Okay, apart from that, bipolar disorder like manic and depression, organic mental disorder, already the patient is having some medical problem in the brains. Because of that, they are getting some psychiatric illness, that is called as what? Organic. Already because of some medical issues in the brain, they are getting some psychiatric illness. That term is called as what? Organic. Okay, so organic mental disorders like dementia, delirium, and organic mood disorders like bipolar also. Okay, all these things will be indication for ECT, but the first and foremost indication is major depression with a suicidal tendency. Okay, the most common form of ECT used in the hospital is, okay, almost all the important question which is related to the ECT is covered, and also I am giving the additional points also which is very important for the upcoming examination. Fine, the most common form of ECT used in the hospital is, okay, so they are asking the common form of ECT, direct ECT, modified ECT, both A and B, and none of the above 4 options are there. And here the right answer is what? Option B, that is modified ECT is the most common type of ECT used in the hospital setting. So what is that? So first we should know about the types of ECT, direct ECT and modified ECT. There are 2 types of ECTs there. Okay, so first let's discuss about the direct ECT. The explanation is given here. In this, the ECT is given in the absence of anesthesia and muscle relaxant. There is no anesthesia and no muscle relaxants like succinylcholine or, no anesthesia was given for the patient. Directly they are giving ECT. So that is called as what? Direct ECT, and nowadays it is not at all recommended in any hospitals. Okay, so direct ECT means 2 key points you're supposed to remember: absence of anesthesia and absence of muscle relaxant. directly we are giving ECT. So that is not at all recommended nowadays. Okay, so the next type of ECT is modified ECT. This is very commonly used in hospital settings. Modified ECT. See here, the electrodes are placed on the side of the patient head just above the temples. I will be showing the image. Okay, no need to worry about that. Okay, the next one is the patient is given anesthesia. This is the important key point. In direct, no anesthesia, no muscle relaxant, right? Whereas here anesthesia is given, muscle relaxant is given, and even atropine injection to decrease the level of secretion. So these three medications are given for the patient: muscle relaxant and anesthesia, and to decrease the secretion, atropine. So these are all the medications we are giving for the patient, and then only we are giving the small electrical current to pass through the brain. Okay, so this is called as what? Modified electrical convulsive therapy. So during ECT, the electrodes are placed on. So, okay, so here we are going to cover another topic. So that is the electrodes are placed on during ECT. Direct question. So here, four options they have given here: submandibular, temporal region, occipital region, and supramandibular region. And here the right answer is what? Option B, that is temporal region is the right answer. So during ECT, the electrodes are placed on the temporal region. Okay, so now we should know why, what is the reason, and where, which is the measurement for keeping these electrodes. So for knowing that, you should know the types of electrode placement: bilateral and unilateral. Two types of electrode placements are there. You can see very clearly here. Yes. So this is the this image. First, see this image. This is the unilateral placement of the electrodes. Okay, unilateral electroconvulsive therapy. And this is the bilateral electroconvulsive therapy. In both the temporal lobe, they will be giving the placing the electrodes, and they are applying the electrical current. Whereas here, temporal lobe and in the parietal region, they are keeping the electrodes and they are administering the electrical current. Okay, so this is called as what? Unilateral, and this is the bilateral. Image-based questions are very common nowadays, so you should know what is unilateral ECT and what is bilateral ECT. Okay, so these are all the image. This is the image for unilateral, and this is the image for what? Bilateral. Okay, so unilateral placement, you can see here clearly. First, let's see the theory part, and then we can go to the image one. In unilateral, one electrode, it is placed over the, see, always in the non-dominant side we will be keeping the electrodes. Okay, for example, if the patient is right-handed, means we will be going for left side. If the patient is left side, means that we have to go for what? Right side. Okay, so non-dominant side we have to use. So electrode is placed over the non-dominant frontotemporal area. So this is the frontotemporal area. Okay, so in between the targus of the ear and outer canthus. So this area is called as what? Frontotemporal region. And another area is centroparietal scalp. You can see here, this is the centroparietal scalp. Okay, in these two region only they are keeping centroparietal scalp and frontotemporal region. In these two areas they are keeping the electrodes. Okay, so this is called as what? Unilateral placement. And the next one is bilateral placement. You all know the, just now I have shown the image of bilateral. This is the bilateral. So both temporal lobe they are using. How to measure this temporal lobe region? You can see this is the outer canthus and this is the targus of the ear. In between these two areas, we have to mark the imaginary line, and from the center of the imaginary line, we have to measure 4 centimeter. How many centimeter? 4 centimeter. Once again, I will repeat. In between the outer canthus and the ear, we have to mark that. You have to make a imaginary line, and in the center, from the center of the imaginary line, in a vertical direction, we have to measure 4 centimeter, and in this area only we have to keep the electrode. On either side of the temporal region, we have to keep the electrode. That's why it is called as what? Bilateral. Even it is called as what? Bitemporal placement. Okay, guys, fine. And the next important thing is complication. So now we know about types of ECT and types of placement of electrodes. Okay, how much electricity we are going to use for the patient. Okay, volt and duration, everything we have discussed. Okay, now we are going to discuss about what? Complication, side effects. So complication is fracture. Okay, so previously if you are using the unilateral, we are not using any general anesthesia, not using any muscle relaxant. That time the fracture is very, very common because of rigorous tonic-clonic seizure. Okay, but nowadays we are using what? Modified ECT. There is frequently we are giving succinylcholine and anesthesia, general anesthesia we are giving. So this type of fracture is not at all common nowadays because of using what? Modified ECT. Apart from that, the complications of arrhythmias, that is dysarrhythmias and respiratory arrest. Okay. And the side effects, you know, memory impairment, drowsiness, confusion, restlessness, poor anxiety, you know, memory impairment in the sense amnesia, retrograde amnesia or anterograde amnesia, anything might be there. Poor concentration, headache, anxiety, headache will be severe, and the patient will be having muscle ache, tongue bite, and incontinence of urine will be there. So these are all the side effects of giving the ECT. Okay, so the next one is medication. So we have seen the side effects, complications. Okay, and now the next important topic is medications used in the ECT. So overall, all the topics we have covered here. Okay, in 360-degree, we are focusing and covering and giving to you. Okay, so medications used in ECT, you can see very clearly. So we are using atropine and muscle relaxant like succinylcholine and anesthetic agent like thiopentone sodium, and the dosage also given here. Atropine 0.6 mg to 1 mg, and succinylcholine, that is muscle relaxant, we are giving 1 mg per kg per body weight, and thiopentone sodium 3 to 5 mg per kg per body weight we are giving for the patient. As you all know, during ECT, during even seizure, we are inducing the seizure, right? So definitely secretions will be more. So in order to reduce the secretion, we are using the atropine. At the same time, if you are giving the atropine, sorry, if you are inducing the ECT, you know, the vagal nerve stimulation is going to take place. The heart rate is going to be decreased. In order to prevent the cardiac arrest, we are giving atropine so that it increases the heart rate. Okay, fine. To protect the heart from the parasympathetic overtone. That is the exact word we have to use. Okay. The next one is anesthesia. That is short-acting anesthesia like thiopentone we are using here. Okay, and muscle relaxant like succinylcholine to minimize the or prevent the convulsions. That is, you know, clonic seizure. To decrease the intensity of the clonic seizure, we are using the muscle relaxant because the fracture will be more common in case of severe clonic seizure. Severe clonic seizure. What is the other name of clonic? That is jerky movement or convulsions. Okay, now these things will cause what? Fracture. So in order to avoid that, we are giving what? Muscle relaxants. Okay, so all the topics we have covered related to ECT. So thank you very much, and if you like this video, please like it, share it, and subscribe the channel so that whatever the video which is related to upcoming examination, we are posting regularly in morning magic pill session. So watch the video and update your knowledge, guys, and all the best for your upcoming examination. Thank you very much.